in the process of swallowing that causes choking, and food ends up getting stuck either up in this area or worse in the tracheal area, and that's when we can no longer breathe and our airway gets covered. And so what is choking? Choking occurs when an object such as food blocks a person's airway. Now that we know what choking is, we're going to go ahead and talk about what causes choking. But before we do that, I wanted to ask you guys 3 questions. And we have 30 seconds to answer each question. And I didn't realize there's going to be so many people here. I actually created these true and false banners, and I was going to pass it out. But instead, I'm going to modify it right now. And if you think that the question is true, then go ahead and raise your hand. If you think that the question is false, then go ahead and leave your hand down. So this is the first question. All right, the next question. True. Okay, and the last question.
Yeah.
I'll give you guys a few more seconds to think about that.
True. Cake can be really dry.
Yeah. Together though might go well.
Cake and milk. No, but it has that phlegm.
Cake and milk.
All right, perfect. This question was a little bit tricky, and this is actually true. Cake and milk are very dangerous to the elderly patient. And I'll talk about the answers in the next slide over here. What causes choking in the elderly? So there are several things that can cause choking in the elderly. First of all is normal aging. The normal aging process, as we get older, we lose the ability to produce saliva. And because of that, when we do swallow, our throats are not lubricated, so sometimes food can get stuck, which is why something as innocent as cake can be very dangerous to the elderly patient. If you give them cake, it gets stuck. Oftentimes we think it's a great idea to give them something to wash it down, something like, let's say, milk or water. You give them milk or water, the cake ends up expanding in their throat, and then it gets a bad situation much worse, and then they start choking. And then dementia and forgetfulness. Forgetfulness is a process, the effects of dementia. And as we know, with dementia, we start to forget simple things that we do, simple tasks in life. We forget how to put on our shoes. We eventually forget how to put on our clothes, how to brush our teeth. And as the disease progresses, we end up also forgetting how to do something as simple as swallowing, something as simple as we've been doing every day of our lives. And so that's how dementia can cause choking. Other diseases that can cause choking are things like stroke, because with stroke we lose the ability to control 1/2 of our body. Alzheimer's, I know we have a very nice Alzheimer's unit here, and Alzheimer's can cause choking as well, or the disease process of Alzheimer's can cause choking. And medications as well can cause choking. Can anyone tell me how medications can cause choking?
You may swallow the pill the wrong way.
Exactly. Exactly. So sometimes we end up crushing their medications or giving it with applesauce. Medications can cause mechanical choking because the medication itself can get stuck in the wrong passage. Otherwise, medications can also cause choking because medications have many side effects. Some side effects of medication are dry mouth, so that's the lack of saliva. Sedation or drowsiness. When we try to eat, when we're sedated or drowsy, then we're at the risk of choking. And also, some medications cause muscle relaxation. And because we're so very relaxed and our muscles aren't working as they should, then things can get stuck along the way from the mouth down to the esophagus. And as we mentioned, dentures as well. Dentures seem like a very innocent object too, but dentures, if they don't fit correctly, they can disturb the process of chewing. So sometimes food isn't chewed properly or small enough, they get stuck. Or they can also disturb the process of the tongue pushing back the food into the back of the throat, so the process of swallowing itself. Okay, so what can you do as caregivers to prevent choking? That is the golden question. Well, first of all, we can prevent it from happening. And how can we prevent that? We can assist during mealtime. We can offer foods that are appropriate for each individual patient. Some patients can take thin liquids like water, while other patients, sorry, I'm using the word patient because I'm a nurse, but here you probably use the word resident. Some residents can swallow thin liquids, and some residents need liquids that are thicker, so we mix it with thickening agents. Limiting the distractions also while eating can help prevent choking. So something like turning off the TV can really help to help the patient to focus on eating. Other distractions are talking and things like laughing as well. We could also learn the signs and symptoms of choking. Can somebody show me what the universal sign of choking is? Exactly. The universal sign of choking, I just taught a CPR class here a few days ago, and so everyone here, they should all know, but this is the universal sign of choking. When you see someone doing that, and they're still coughing, then you encourage them to keep on coughing, because then they're not truly choking. The time that we really worry is when they're doing this, and they're no longer coughing, or they're no longer breathing, or they can no longer make a sound. And in that worst case scenario, it's really important to know what to do in case of choking. And before we do that, I have another series of 3 questions. I'm going to go ahead and ask you. If you think it's true again, raise your hand, and if you think it's false, then leave your hand down. You think it's true or false? When allocation or person is choking on water, we should
I think you would do it, but I don't know.
Right, and the answer to that is actually no, we should not. Because water is an object that doesn't truly get stuck. The only time we do the Heimlich maneuver is when the total airway is blocked. And we'll explain that more in the next slide. But here's the second question.
If you don't know what they're choking on, should you err on the side of water?
If you don't know, then definitely err on the side of caution and prepare to do the Heimlich maneuver and the back blows, which I'll be talking about soon. That's a good question. Thank you. Next question.
Wait, Arnold, I will
Alright, you guys are correct. This is definitely a false answer. We do not wait till 911 and the paramedics get here because by then it'll be too late. So what we need to do is start acting and try to dislodge the object, and then when the paramedics get here, they can pick up where we left off. And the last question.
My mom.
That's a trick question.
All right, if you think this is true, raise your hand. If you think this is false, leave it down. Okay. Well, it's actually false. Thank you for being brave to raise your hand. We don't want to pat them on the back while they're coughing because that can disrupt the process of coughing, and they can actually end up choking, and it can make the situation worse. But what we can do is we can encourage them to keep coughing. So we go up to them and we just tell them, go ahead and keep coughing. And we stand by just in case they start choking. We'll stand by so that we can act quickly. All right. So I do have another short video to show you what to do when a person is choking. And then afterwards, we'll go ahead and do a demonstration. This is a video from the American Red Cross.
When something is lodged in someone's throat, the natural response is to cough. If the person is coughing forcefully, he's getting air. Encourage him to keep coughing. If a conscious adult or child can no longer cough, speak, or breathe, he may be choking. Have someone call for help and obtain consent.